Thank you for checking out Dr. Christine Greves' website. I'm sitting down with her today to talk about all of your most important questions about the female body. So let's dive right in. Dr. Greves, what should women do if they're experiencing vaginal discharge? This might be something kind of embarrassing that a lot of women don't want to talk about, but it's a real thing that many of us experience. I've had friends tell me that they may have a weird odor or a weird color to it. How do we know if it's something that's concerning or something that's normal? When should I come talk to my doctor about it?
In considering why people have a vaginal discharge, it's important to ask yourself, have I had it before? Have I had any lifestyle changes? Meaning, were you at the beach for 2 days without changing the bottoms of your bikini? Were you in a new sexual relationship? Are you having an odor? Are you having any pain, any fever, chills, things like that? So those are all questions that need to come up, and with medicine, trends are everything. So just know what your normal is, and then start asking yourself questions like this as to trying to figure out what it can be. And if you don't know, or if you're concerned, guess who's there to hold your hand? Your doctors, okay? So what you can do is ask yourself, number one, do I have itching? If you have itching, if you've had a nice warm, moist environment, if you have diabetes, or if you have something that decreases your immune system, if you have had a lot of sugar, things of that nature, and you have a white, cottage cheesy type of vaginal discharge, that could be a yeast infection. Now, mind you, you need to have an exam, but I'm just trying to help you with trying to figure out what it could be, because I know instead of looking online, it might be kind of nice to hear what the options could be from somebody who's been trained to do that. So anyway, so that's one option. And then, have you had it before? If you've had it before, you may want to try something over the counter, a cream, a 3-day or 7-day cream that could help you. Okay, it's an antifungal, and you can find it in the little area in the pharmacy, and you can be directed to that, like miconazole, for example, or chlorotrimazole. Those can help. So then the question may be, well, do I have an odor? If it's an odor, and the discharge is not white, cottagey, cheesy, and it is a little different in color, more copious, a little bit more amount, you could have something called bacterial vaginosis. And that's when the flora of your vagina also gets a little bit out of whack, and certain bacteria that cause that vaginal odor, that fishy odor, especially after intercourse, when those prevail. And that is something that you'll need to see your doctor for, to make sure that we can give you the right antibiotics, evaluate you for that, etc. Then the question becomes, are you sexually active? And could there be a new sexual partner? And if you do have a new sexual partner, then the question may be, could it be an infection? If you are having pain, like pelvic pain, if you're having a fever, chills, and the discharge just isn't right, sometimes the discharge can be green and frothy as well, which is called trichomonas. That can be something that would need to be brought to your provider's attention. The other thought is gonorrhea and chlamydia can also present with a vaginal discharge. Sometimes women just have a discharge, and it's called a physiologic leukorrhea. It's just a physiologic discharge. So some women have it, and that's just part of who they are. But in order to get peace about that, it's best to bring it up to your provider to just make sure everything's safe. Now, if you do have a vaginal discharge, does it automatically mean you have an infection? No, that could be your body. But it is important, if you do notice anything different about your body, to start wondering and asking, what could this be? Just to make sure that you're safe, get it checked out, to have peace and nip something in the bud.